Structures of the head and neck are enveloped by fascia. This fascia is broadly categorized as superficial and deep fascia. The superficial fascia lies directly beneath the skin and envelops the platysma and muscles of facial expression. The deep fascia is further categorized into 3 layers: the superficial investing layer, the middle layer, and the deep layer. The investing layer completely surrounds the neck and envelops the sternocleidomastoid, trapezius, submandibular glands, and parotid glands. The investing fascia attaches superiorly to the nuchal line, zygomatic arch, and mandible. Superiorly, the fascia splits to cover the masseter and medial surface of the medial pterygoid muscle. The middle layer, also called the pretracheal fascia, is divided into a muscular division and visceral division. The muscular division of the middle layer envelops the infrahyoid strap muscles. The visceral division of the middle layer attaches superiorly to the hyoid bone, the oblique lines of the thyroid cartilage, and the base of the skull. Inferiorly, it is continuous with the fibrous pericardium. The buccal pharyngeal fascia is a part of the visceral division that covers the pharyngeal constrictors and the buccinator muscle. The deep layer is divided into the alar layer and prevertebral layer. The alar layer attaches to the base of the skull superiorly and to the buccal pharyngeal fascia inferiorly. The prevertebral layer extends from the skull to the coccyx. All of the layers of the deep fascia interact to form a compartment called the carotid sheath. The carotid sheath attaches superiorly to the base of the skull and extends inferiorly to the thorax. The fascia, along with other structures, form anatomical spaces which are grouped into facial spaces, suprahyoid spaces, infrahyoid spaces, and spaces that extend the entire length of the neck. Among the facial spaces is the canine space, which is the potential space between the levator labii superioris and the levator anguli oris. The buccal space, which sits superficially to the buccinator muscle and is bordered by the zygoma, the musculature of the mouth, and the pterygomandibular raphe. The parotid space, which is primarily filled by the parotid gland. The masseteric space, which sits between the masseter muscle and the mandible, and communicates with the superficial temporal space. The superficial portion of the temporal space sits between the temporalis muscle and the temporal fascia. The deep portion of the temporal space is bordered laterally by the temporalis muscle, medially and superiorly by the skull, and inferiorly by the lateral pterygoid muscle. The pterygomandibular space is another facial space. It is bordered by the pterygomandibular raphe, the pterygoid muscles, and the mandible. It also communicates with the lateral pharyngeal space. The suprahyoid spaces include the lateral pharyngeal space, which is bordered anteriorly by the pterygomandibular raphe, posteriorly by the carotid sheath, inferiorly by the hyoid, superiorly by the skull, laterally by the medial pterygoid and mandible, and medially by the pharynx. The sublingual space, which sits between the mylohyoid muscle and the musculature of the tongue. The submandibular space, which sits between the investing layer of the fascia and the mylohyoid muscle. And the peritonsillar space, which sits between the superior pharyngeal constrictor and the palatine tonsils. The pretracheal space is an infrahyoid space. It contains the trachea and extends inferiorly into the mediastinum to the level of the pericardium. Spaces that extend the entire length of the neck include the superficial space, the carotid sheath, the prevertebral space, and the retropharyngeal space, which sits between the visceral fascia and the alar fascia. The potential space between the prevertebral layer and the alar layer of the deep fascia is known as the danger space, because it can serve as a pathway for infection in the pharynx to spread into the mediastinum. Infection in other spaces can spread and lead to life-threatening conditions. For example, infection in the carotid sheath can spread to the cranium, causing encephalitis. Infection in the submandibular and sublingual spaces can lead to an accumulation of fluid underneath the tongue that can obstruct the airway in a potentially fatal condition known as Ludwig angina. Dental infection can spread from the teeth to the anatomical spaces and from one space to another. Infection from maxillary abscesses can spread to the buccal, canine, and infratemporal spaces. Infection from mandibular abscesses can spread to the buccal, parotid, submandibular, sublingual, masseteric, and pterygomandibular spaces. From the submandibular, sublingual, masseteric, pterygomandibular, and peritonsillar spaces, it can spread to the lateral pharyngeal spaces. Then, from the lateral pharyngeal spaces to the carotid sheath and the retropharyngeal space. And from those areas, infections can spread to the cranium and mediastinum. The relationship of a molar's root to the anatomical landmark known as the mylohyoid line affects the path of infection. Infection in molar roots above the line spreads to the sublingual space. Infection in the molar roots below the line spreads to the submandibular space.